Good morning, everyone. This is Dr. Susan Marra with Dr. Marra's Medical Minutes. And today we're going to talk about authentic excellence in the field of tick-borne illness and mold illness. And the reason that I'm talking about this, it's a little bit off topic. It's not sort of clinical or science, but it's been a concern that I've had as a result of some new patients that have come to me from other practitioners. And what I'm seeing is that a lot of the other practitioners just don't know what they're talking about. And I'll give you an example. I had a new patient come to me with a Western blot, not through Igenics, through, I believe it was either Quest or LabCorp. And it just had a positive band 41 on IgM. Well, band 41 is not Lyme specific. Band 41 is flagella specific. Flagella is the tail on a spirochete or other bacteria like H. pylori that allow it to be mobile and motile. And it is not Lyme specific. The bands that are largely Lyme specific are band 18, 23, 31, 34, and 93. Now, there are some other ones like band 58. When you see that, that should raise a suspicion. But in general, those are the Lyme specific bands. In other words, if you show positive for band 18, 31, 34, 23, or 93, you most likely have been exposed to the bacteria that causes Lyme disease. And that is called Borrelia burgdorferi, or one of the Borrelia. If you only test positive for band 41, that is not Lyme specific, and you cannot say that the patient has Lyme disease. It is inaccurate. That is not correct. The other thing is that it takes between 6 and 8 weeks after the time of a tick bite or an insect bite for antibodies for Lyme disease to develop. And that's true across the board. It's not that some people develop them in a day and some people take 10 weeks. No, it's that in general, it takes 6 to 8 weeks to develop antibodies for Lyme disease. Therefore, when you get a tick bite and you go to the doctor and they do an antibody test, if it's done in less than 6 to 8 weeks from the time of the bite, it will be inaccurate. This is not correct. And you can call Igenics, you can call MDO, you can call Armin Labs, you can call any of the large, well-known, high-quality tick-borne illness, lab companies and ask them, and they will tell you, no, you cannot measure antibodies within the first 6 weeks. They will not be accurate. So there is something to be said for authentic excellence. And authentic excellence applies to any profession. And what it means is that the clinician that you're going to is in command of the information regarding tick-borne illness. And generally, when you see that somebody's been practicing 25 years, that's a pretty good indication that they're probably very Lyme literate. I would say if you are looking for a doctor, anybody who has less than 10 or 15 years in tick-borne illness or mold illness, I would not recommend them. They don't have enough experience. It takes a long time to get really good at this. And even then, you have to perfect your craft by attending virtual conferences, by going to conferences, by calling compounding pharmacies, by talking to colleagues. I mean, it's really, it's important that the doctor that you choose is staying current and relevant on information. And, it's very difficult as a consumer to assess that. And I understand that. And that's why I'm doing this video, is I just want to caution people when you are looking for a Lyme literate doctor, that you be very, very careful about who you go to. You probably need to interview them. You need to talk to other doctors. You need to do your homework. I know that's what I do when I have to hire a doctor. I do my homework because just because someone says they're good, that's not enough. You have to make sure that in the industry they're well respected. So, anyways, I hope this information has helped you, and have a wonderful day. Bye-bye.